as you age, the more independent you can remain, the generally happier people are and longer they live. Specifically, the longer their health span. So with longevity, I think about and focus on what each patient or person likes to do, right? And what they would like their life to look like as they age, because everybody's level of activity or desires are different.
Hi, Dr. Sharp. Thank you so much for joining us here on the Integrative Women's Health podcast.
Thank you so much for having me.
Most of us who come to thinking more of an integrative approach, functional nutrition, functional medicine approach, come through some kind of personal or family or client's story. Is that true for you?
I would say yes. I would say a couple of things. So definitely a personal interest and also, as you said, client or patient interest. So, I had a lot of patients initially when I was right out of residency that had a lot of GI symptoms that weren't necessarily explained by the more traditional medicine workup. Even when I would refer to GI, they didn't always have a solution for the symptoms or a clear etiology. And so that kind of opened the door to thinking like, is there more that we can be doing or is there more that we can offer these patients? And then additionally, I would say that I suffer from IBS. So I had a personal interest in also figuring out what was going on. So those two things together really opened the door to functional medicine. And now I really enjoy taking an integrative approach. And I think that it's interesting because COVID has also kind of opened the door for people being more engaged with their health overall. And I think also more open to exploring more different styles in terms of different remedies and supplement options and things like that. And really one of the things that I love the most about having more of a comprehensive knowledge of integrative and functional medicine is being able to give patients options.
Yeah, that's really true. I think it expands the toolbox, if you will.
Yeah.
And so you work in uh, internal medicine, very generalized. Is your practice generalized, or do you tend to focus in particular areas?
Yeah, so I would say I do have a general internal medicine practice in terms of general primary care, but I also do weight loss. So I
Mhm.
would say that's a particular area of interest. And then I would say in terms of the integrative approach and integrative medicine, I would say that kind of lends itself to weight loss because in my practice, I specifically blend medicine, exercise, and nutrition for all of my patients. And so another way to put it would be like body composition optimization and health optimization, which is something that is, I would say, kind of more longevity focused. So one of the biggest things I try to focus on is not just symptom management or disease diagnosis, but more long-term health management. So like, how are you going to feel in 10 years? How are you going to feel in 20 years? That kind of thing.
So, what is the general age range of people in your practice?
So 18 and older. And I would say the general age range is probably around, I would say 30 to 60.
Mhm. And so are these people coming to lose quite a bit of weight, or do they have kind of the, post-baby or perimenopausal or postmenopausal metabolic shifts or inflammatory issues or that are triggering the weight gain or the weight loss resistance in general?
Yeah, that's a great question. I think it's a combination. So there's really two types of patients, right? So one would be a type of patient that may have struggled with weight for their majority of or the entirety of their adult and maybe even some of their childhood life. And then there are patients that have had an inciting event that have caused weight gain. And there's definitely different management strategy depending on what the etiology of the weight gain was.
Yeah, that makes a lot of sense. So I would imagine being in the weight loss or weight loss resistance space that you talk a lot about GLP-1 agonists with your clients.
Mhm.
So, from a functional and integrative perspective, of course, we want to put these new tools or newish tools. I suppose we could talk about GLP-1 agonists as being peptides that have been around for quite a while in the research, but generally we put these into context. So that's not the only tool. So can you
Mhm.
talk about how you might use GLP-1 agonists in a more comprehensive approach and how you might use them for someone who maybe has a lifetime of low levels of GLP-1, that first category of clients you were talking about, in the same way that people might have low insulin and type 1 diabetes versus someone who has an inciting event. We're interestingly seeing a ton of use of GLP-1 and improvements in GLP-1 agonists in people with endometriosis, so like other inflammatory conditions.
Mhm.
How would you categorize, how do you use this in your practice in a more practical way without just prescriptions for GLP-1 agonists?
Yeah, so I would say that's kind of exactly what I do in my practice is I don't just prescribe the medication, but I always have the exercise and nutrition plan that's paired with the medication because the goal is really to foster positive behavior changes to reinforce the changes that are occurring with the medication as well because that's what actually maintains the weight loss, right? So the goal would be to not have to be on the medication forever if you're not a diabetic, right? And so the goal would be to actually be able to have a metabolic reset, especially once you lose a significant amount of weight. You've reversed a lot of the hormone dysfunction, and then you have a new baseline or homeostasis, right? And so that's really what I focus on in my practice is that positive behavior change. What I like about the medication and pairing it with diet and lifestyle changes is that you get a lot quicker of a response from the medication in terms of weight loss. So it actually forms a positive feedback loop with that behavior change that can be really challenging for patients, specifically like the ones that you mentioned, maybe with PCOS or endometriosis, where they're making a lot of changes. It's challenging, it's difficult. There's a lot of compromise in terms of what they're eating and their lifestyle, and they're not getting the results that they want, right? The medication helps them get those results much quicker and then it reinforces those positive behavior changes that can really help to change the mind body connection, the gut brain axis, and improve not only physical health, but also mental health.
And so, do you think there are a subpopulation of people who really need these medications? Like, in my experience, many
Mm.
people with endometriosis or PCOS or perimenopausal shifts, or even some chronic post infectious issues, we see people really commit to the diet and lifestyle. And it does not move the needle for 10, 15 years. And then we layer on these new GLP-1 agonists and we see a change. So do we think physiologically for some people they actually need that additional medication?
I think that they need an additional boost to help in terms of the hormone reset because I think that what makes it so challenging to lose weight in a more traditional sense for people who have a well established homeostasis at a higher weight is that the hormone balance and everything physiologically in your body is set to try to maintain a stable weight. So as you lose weight, everything in your body tries to get you to regain that weight, right? In terms of hunger cues, in terms of slowing down your basal metabolic rate and all of those things. And so there are a lot of things that you can do to counteract that in terms of, for example, one of the things I specifically do in my practice is we monitor not only body fat percentage, but lean muscle mass. As we know, muscle mass requires more calories than fat to maintain. So
Mhm.
you can have a very similar basal metabolic rate at a much lower weight if you maintain your muscle mass. Versus what happens with a lot of people who kind of like yo-yo diet and try to do these things without, in consuming enough protein, maybe without doing enough resistance training, is they actually end up with a higher body fat percentage at a lower weight. And then when they regain weight, because they would need less calories now to maintain this lower weight, and then once they kind of go off the diet protocol, or intervention, they are going to eat a little bit more and regain that weight. Then they end up at an even higher weight with a higher body fat percentage than they started. And so it can become a very vicious cycle, and that can be really challenging. So I think having the tools to understand exactly how to go about healthy diet and exercise, and then also having something to help jumpstart that hormone balance. Um, because everything is kind of, as I was saying, working against you to lose the weight, can be really important for people who have, as I mentioned before, just that kind of well established homeostasis. And as we know, with obesity in particular, as a disease overall, the hormone balance is quite different than in a non obese individual, right? So in terms of different hormones that are in your body that are actually promoting maintenance of the fat tissue, it's actually in favor of maintaining that weight, and it can be really, really challenging to lose it. So I do agree. I think that the case could be made that some people really do need something like a GLP-1 medication or GLP-1 medication to help shift that balance.
And one of the things I'm really interested in when it comes to these medications is the fact that we're seeing such benefits in other symptoms. So, for example, people that are on a GLP-1 and get COVID are 33% less likely to have a severe case. Or people who have endometriosis go on the GLP-1 and then have, without any weight loss yet, have less pain. What do you think about some of those benefits?
I think it goes back to the hormone balance component. I think it really helps in terms of shifting that, as well as I would say, the gut brain axis is very powerful. And I think that that's something that can't be overlooked in terms of the complexity of the neural pathways and the fact that GLP-1 medications do impact the pleasure reward system in the brain. They do impact the overall, I would say, like hunger cues and also your metabolism, right? So, all kinds of things are being impacted, not just, I would say, like fat burning or weight loss, right? And so I think that that really plays a role in terms of some of these other symptoms, in terms of, I would say, also mood and energy levels. And then I think the other thing is there could be a lot of things that I would say could be similar to food noise, that could be similar to,
Mm.
let's say, symptoms of chronic pain, where there are these chronic signals in the brain that are, really fatiguing, overwhelming, and challenging for people to deal with on a daily basis. And if you can just turn that volume down a little bit, I think it can really alleviate a lot of stress. And so there could be a component of that. I would say that's just my own opinion. So, take it for what it's worth. But I would say definitely something with shifting that gut brain axis and the hormone balance for sure.
Well, and certainly potentially like inflammation or even cellular autophagy, other things that we find do similar things like fasting, sometimes we'll get similar results, but it's harder to
Hmm.
maintain long term, same idea.
Mhm. And it does the same thing where, like, if you've been fasting for, I don't know if you've ever done intermittent fasting, but it certainly quiets the food noise after a bit, right? Because 'Cause
Mhm.
you're just like, it's not part of the program. So, you move on to thinking about other things. But yeah, I think you brought up a really good point too with the inflammation. Undoubtedly, it definitely helps reduce inflammation, and I think, again, it's I think, multifaceted or multifactorial in terms of with weight loss and reduction in adiposity, you definitely reduce inflammation. But I think that there are other pathways in terms of even insulin and some of the other incretin hormones that are impacted by these medications that are greatly reducing inflammation, specifically probably related to blood sugar levels as well. And also just those feedback loops with the neural pathways.
Any major downsides you're seeing?
Well, I would say that if people aren't taking them and they're not doing the recommended strength training. They're not in I would say increasing their protein intake with weight loss. They can lose lean muscle mass, which is something we talked about before. That can, make things more challenging, especially for maintaining the weight. In addition, there are some side effects, and some people are more affected than others just with the GI side effects. So constipation would be the biggest one that I see. That's largely treatable and manageable, especially if you get ahead of it. But I would say something definitely, that can't be overlooked and should definitely be discussed. Sometimes a little bit of nausea. And for the most part, I would say other symptoms like, let's say, increase in reflux symptoms or even nausea, um, are generally impacted by overeating on the medication because you eat so much less,
Mm.
and or eating less healthy foods, so greasier foods, in general, which typically would cause reflux symptoms anyways, have a higher propensity to do so on the medication.
Are you seeing any tachycardia? Because I'm hearing about that a little bit with people in the long COVID community who are taking it for that, for the inflammation related to long COVID.
Yeah, I've seen it a little bit, but I would say generally it's something that is multifactorial also. So, for example, maybe somebody who has hypothyroidism, they're losing weight, we need to reduce their thyroid medication dose a little bit, and they're more sensitive as a result of having lost the weight and being on the medication. I've seen it a little bit, but I would say in terms of the mild sense, so something where also people might be a little bit more reactive to activity,
Mm.
but nothing kind of that would be alarming, but I would say for sure noticeable in a few patients. And I think one of the other things that exacerbates that is that while the medication decreases hunger cues, it also decreases thirst cues. So, especially during the
Mm.
summer, making sure that people stay hydrated is really important on the medication.
Yeah, and I think may also be related to dysautonomia that can be triggered by that kind of slightly slower gut motility since there's so much dysautonomia in that population.
Yeah, for sure. It's definitely one of the known side effects of the medication.
Mhm. So it's just a matter of how severe it is for whether or not a person can tolerate it or or it's a good, it's okay to kind of navigate it, change the dose, things like that.
Well, I would say also it's a very small percentage of the population. I think when you take a look at the long COVID population, they also already have an increased risk of having I would say
Mhm.
dysautonomia and an elevated heart rate. So you're looking at a probably particularly reactive subset of the population. Generally, I think I would say tachycardia is reported like less than in 10% of patients. So, a low percentage of the time. Um, but and again, I would say yes, I guess depends on the severity, but not something I've seen a lot of, but definitely has seen in practice. The biggest things I would say are the GI side effects.
Mhm. Yeah, that's for sure. So let's talk about longevity. When you have a client who's coming in their, say, early 50s, who wants to think about longevity for the next 20, 30 years, how do you, what's your
Uh-huh.
kind of approach for that?
I would say it depends. So a couple of different things. Overarching principles are definitely independence and functionality in terms of as you age, the more independent you can remain, the generally happier people are and longer they live. And specifically, the longer their health span. So, health span versus lifespan, right? Health span really highlights the ability to remain having a high quality of life and being functional while you age. And so that's really, I would say, where I focus more than just on lifespan. So with longevity, I think about and focus on what each patient or person likes to do, right? And what they would like their life to look like as they age, because everybody's level of activity or desires are different. And so making sure that we set them up for success in that way. So for some patients, they're already very motivated in terms of exercise. We may focus more on the mental and spiritual component of things, allowing more time for themselves in their life and more time for friends and community connections. With other patients, it might be really optimizing body composition. One of the other things I always focus on is prevention of chronic diseases. That's one of the biggest things you can focus on, especially as a primary care doctor. I mean, the low hanging fruit is blood sugar, blood pressure, cancer screening, all that kind of stuff. But then once you cross that kind of stuff off the list, then it's focusing on really things that you do every day that actually impact your health in the long run. So people don't think about those little habits that they have where, I always recommend like adding 10 minutes of walking in a day, right? If you do that by the end of the week, you've definitely walked at least another mile, right?
Mhm.
Then at the end of the month, you've walked another 30 miles, right? That's a lot. So, it's those little things that I try to focus on. Maybe it's, cutting back a little bit on things that could, increase cholesterol or things like that. And then you really do actually move the needle in the long run. So that's where I'd say I really try to focus. The other thing is I try to be data driven with patients so that we can track their success. So I'm really big on short term and long term goals because I think it fosters that positive feedback loop that we were talking about even with the, GLP-1 medications where I want patients to feel empowered with their health so that they feel like they have the tools to really maintain their health for the long run.
I love that. And so, as we wrap up, I would love to talk about your schedule. Like, you're a busy working professional woman. How do you take care of your own longevity?
Yeah, so well, I do walk a lot, so I do, listen to my own advice. And I've definitely increased that a lot more recently. So I try as much as I can to get that 10,000 step a
Mm.
day goal. And then one of the other things I would say is I do try and make sure that I take some time for, I would say kind of unplugging and some time for just relaxing with daily movement. I love yoga, so I try to do that a good amount. And then one of the things that I'm focusing on for my longevity, and I like to do this anyway, so it's something I've been kind of continuing to work on is cooking because
Mm.
cooking is, I think, one of the best things you can do for your health in terms of, using food as medicine. So those are the some of my passions and things that I try to focus on, besides also getting outside as much as possible, because I think it's just so good for your nervous system.
Yeah, absolutely agree with that. Anything else you want to share with our community for people who are just needing a little bit of inspiration to start thinking about their next 20, 30 years, not just today?
Yeah, I would say I would liken it to standing at the base of a mountain and thinking about how you're gonna get to the top. If you just look at the top of the mountain, it's gonna seem like it's so far away and maybe it's impossible. But really, if you start small, just making those small, consistent steps every day, before you know it, you'll be at the top.
Love that. Excellent. Well, thank you so much for being here with us today, Dr. Sharp. And where can people find you if they want to learn more about your work and your practice?
Yeah, so I can be found on Instagram, Dr. Elizabeth Sharp or Health Meets Wellness. Those are the two Instagram handles. Also, our website, so healthmeetswellness.com. You can learn more about the practice. And then otherwise, you could email the practice at info@healthmeetswellness.com, or you can call the number 917-833-5234.
And you see patients in person in New York City, correct?
Yeah, so I see patients in person in New York City, Monday through Friday, 9 to 5. And then I also do telehealth, and I'm licensed in New York, New Jersey, Wisconsin, Wyoming, Florida. So many states.
Excellent. Excellent. That's really valuable. Well, thank you so much for being here with us today. And thank you for your very inspiring practice. I think the more that physicians think preventatively and integratively, the more opportunity we have to kind of dig out of this hole of chronic illness.
Yes, thank you so much for having me. I really appreciate it.
Thank you.